Now joined by Dr. Peter Chin Hong. He's an infectious disease specialist and professor of medicine at the University of California, San Francisco. Good to see you again, Doctor.
Thanks for having me on, Gerald.
Absolutely. Now, most of California under a strict lockdown, as we've said, and that will go beyond Christmas. What happened there? Because your state was doing so well after its first round of stay-at-home orders back in March.
Well, I think, Gerald, what was happening was a combination of three things. The first was, of course, it's colder in California, so people are gathering more indoors. A lot of the current epidemic is probably driven by indoor activities, although it's very widespread at this point. The second reason is, of course, pandemic fatigue, or some would even say pandemic resentment. Even though there is a stay-at-home order, more than 50% of Californians are still out and about, and of course we've seen more than 1 million in the U.S. travel during Thanksgiving. So one aspect is messaging, and the third issue is that we can do all we can in California, but because the rest of the country is on fire, we were becoming increasingly boxed in. And of course our borders are not porous, very porous, sorry.
Right. Now, Doctor, the California order was, of course, triggered by the shrinking capacity of its intensive care units. Can you talk to us more about how California's healthcare system is coping and the broader issue nationwide?
Yeah, so I would make a first comment that California, even though we have great facilities, because our population is so huge, per capita, we actually don't have as many hospital beds as some of the other states. And when you have so much COVID widespread in the states, our ICUs are being really hit hard in a winter time when, ICUs are generally filled anyway. So they've recently, again, started enacting restrictions based on the capacity of ICUs. So some areas in California are already over 90% full in ICUs, some dangerously close. And the rest of the country, very similar. Again, we don't have much give because in the previous times, we can go to New York to help them out when they were having problems. We can go to the Navajo Nation. Now everyone is having problems, so personnel is another issue that goes into the formula with ICU beds.
Right. Now, so much hope is riding on vaccinations, which we hope will come online really soon. The Trump administration says some 24 million people will be vaccinated by mid-January. Do you think this is achievable?
I'm not sure if 24 million can be easily vaccinated by mid-January. I hope so. Again, because we haven't had very much success with distribution in the past in COVID in the United States, like with PPE or even diagnostic test supplies, I'm just a bit worried about that. But nevertheless, on a state-by-state level, I know everyone's gearing up, but it probably would just be tipping, giving a fraction of the front line of the front line. But hopefully we'll see that happen.
And Doctor, what challenges do you foresee in, distributing the vaccines once they become available and getting people to actually take the jabs?
Yeah, so the challenge is one both of distribution, because the Pfizer vaccine in particular requires negative 70 degrees Celsius. So you have to have not just a regular deep freeze, but a research level type deep freeze. They can then be issued to the community in these small little kits with dry ice and can only be defrosted for a certain amount of time. So it's really the cold chain, but the cold chain plus. And the most important aspect is, as you mentioned, Gerald, whether or not someone would actually take it if they were offered the vaccine. Right now, the acceptance in the United States is only about 50%. Even when you look at some populations, I saw some data from firemen in New York this morning, and only about 50% of those would say they would take the vaccine. Again, needing us to think about messaging again.
Absolutely, an uphill battle. Dr. Peter Chin Hong, always good to speak with you. Thank you.